Some causes of pain might be someone that broke a bone and the joint was injured, or someone that has arthritis and gets a knee replacement, but they still have pain that's caused by the joint not working well. There are other causes, like the nerves themselves can be directly injured, either like by a car accident or even just by falling. Many joints can be injured, but the most common ones tend to be the knee and the hip, as well as the wrists. Sometimes the nerves that supply feeling to the joint can be injured directly, and they can either get what's called a neuroma, which is the nerve building scar tissue, or even the nerve can get the signals mixed up, where the nerve keeps telling the body that there's a problem, but there's no actual problem. So in these patients, when the nerve is injured, that nerve keeps firing, keeps sending that electrical signal to the brain, and it tells the brain that there's a problem in the joint, even though there's no problem at that point. So people have this chronic pain that isn't actually there. And so that can be caused by either direct trauma or the nerve being injured for other reasons.
If you deal with a nerve surgeon, is that we often look for what we call a Tenel sign. A Tenel sign is when you tap on a nerve and you get a little bit of an electric shock. And that usually tells you there's a problem with the nerve at that point where you get an electric shock. And again, we call that a Tenel sign. And that's a very important component of a nerve exam. And what we would do with joint denervation surgery is we find those small nerves, and not quite microscopic, but many of them are about as thick as the wire on a paperclip. They're really pretty thin. We find those nerves and we cut them and do some things so you don't have a problem with the cut end of the nerve. And hopefully that denervates the joint. By de-innervating the joint, you don't really cause numbness to the skin. For the most part, your proprioception, or knowing where your joint is in space, is it bent, is it twisted, things like that, is not gone either, because that's much more complicated than that. And the goal of joint denervation surgery is to just take away the pain of a painful joint.
The people who are candidates for joint denervation surgery are people who've had chronic pain in a joint that has been addressed by an orthopedic surgeon, and they've come up with no real answer. The first way we look at joint pain is structural. You go to an orthopedic surgeon, for example, and they'll see if there's anything that can be done. Is there a bone spur? Is there a broken bone history that maybe wasn't addressed properly? Some arthritis, maybe a joint replacement if it's your knee, if we're talking about. So there's a number of things that might be addressed. But once those have been addressed and the orthopedist puts up their hands and says, I've done everything I can do, there's nothing I can do further, well, at that point, it might be time to consider joint denervation surgery, because if you can't feel the joint, then you can't have the pain and you can go on with your life. Recovery from joint denervation surgery is actually very simple. You're generally not doing anything orthopedically, meaning you're not doing anything with the joint itself. So if you've had orthopedic surgery, that recovery is usually a lot more intensive than joint denervation surgery. Usually we do these through relatively small incisions, and what we're doing is we're just finding the nerves that give that pain signal from the joint to your brain, so you have the sensation of pain, and by cutting that nerve through a small incision, we can stop that signal being sent and you don't sense the pain anymore. And so the recovery is very simple. It's just usually a few small incisions in a few key places around whatever joint that we're denervating, and you get on with your life pretty quickly. We might immobilize you for a short period of time, but it's usually not more than a few days, and you usually don't even need any therapy afterwards.